get the whole story.
The challenges of managing blood in Kenya remains a key problem that even affects the attitudes of the citizens towards blood donation. This week on Health Digest, we take a look at how the use of technology can help solve this problem. My name is Sada Hassan. Across social media, you will find posts of blood donation appeals. Citizens backed by health facilities and other organizations have been on the forefront of calling on members of the public to donate blood to save lives. On average, Kenya needs at least 1 million units of blood annually, which unfortunately is hardly met. The situation is worsened by different opinions and perceptions amongst Kenyans on donating blood.
You say you donate blood?
No, bado.
Kwa nini?
Ni sijai donate.
Kwa nini hujai donate?
Sijai bother, but one day I will.
Sijai donate blood, sijai pata mtu anahitaji msaada.
The reason why I don't donate blood is because when you need the blood, you don't get it.
So, hata kama ni relative wako anahitaji blood, would you donate?
Okay, I prefer if a relative needs the blood, at that time, we come together as a family, we donate, then we assist the patient. Yeah. That's the only way we can do. Because here could donate up or you donate, but when you need the blood, you don't get it. Yeah.
Mimi kwa maisha yangu sijawahi donate blood. Nimeona watu wakipeana lakini sijawahi kuwa interested na sijawahi itishwa. Lakini ile siku nitaitishwa na nikipata niko nayo, I will donate.
Accountability and transparency of blood donated remains a big challenge. This has led to majority of Kenyans shying away from this important mission of donating blood. Dr. Benjamin Jia is the medical superintendent at St. Francis Community Hospital here in Nairobi. He explains why we keep having blood shortages.
The donor system in our country, maybe I'll just start from that bit, for a very long time has been dependent on schools and school-going children. And in that way, we find that being part of the national blood transfusion ecosystem allows us to be able to get in touch with the regional blood transfusion service, the national blood transfusion service, and access the blood that we require. Of course, what that means is that in the event that the school holidays have come, then it becomes a big challenge because the national and the regional pool of blood has been depleted. What we have ended up doing is working very closely with our community and those who have entrusted their patients to us to encourage them to donate blood freely. And that blood now goes to replete our pool and becomes accessible to patients who might require that service. And what that has necessitated us to do is, number one, to ensure that we are able to communicate with our donors, especially for those blood groups that are a bit difficult to come by, O negative, for example. But by and large, the first step is when we onboard you as a donor. First, we will notify you of the results of your screening because there is no benefit. You've come, yes, you just wanted to donate blood. We've taken blood and we've screened it as is required of us. And if you were to be asked a day or two later, what was the result of your screened blood, then you wouldn't have that information. So what we are doing is taking that as the first step to acknowledge and appreciate the sacrifice that our blood donors have given in giving us a pint or two, and hopefully that is the beginning of a relationship to have when we require blood and is not readily available, having them being able to step in and replete our pool.
As a way of bridging the gap between patients and the transfusing facilities, innovation is key, and Musasa is on this call. It is one solution that was identified from the Presidential Digital Talent Program, which focuses on the youth by providing them with room for connection, work experience, and space innovation.
I would normally want to have as many as possible. Unfortunately, we are only limited with the budget, so that we are never able to bring in as many as we want. We receive as many as 10,000 applicants. So you can imagine having 10,000 and wanting to reduce them to 300. It's normally a very daunting task. So that is basically looking at the challenges of the program itself in terms of limited budget, and you'd also want to have as many people as possible.
The criteria for choosing participants is quite thorough and vigorous. Each county is represented with grades at the university playing a big role. During that cohort, Musasa was one of the innovations that came from this program. But what is it all about?
An application that looks at how to manage the issue of blood donation and blood distribution. And I think this is one of the programs that we really are happy to associate with, bearing in mind that we incubated it here, and we have also encouraged them to move forward. So it is an application that will really help in terms of ensuring that there is transparency in blood donation, transparency in blood distribution, and actually also encourage people to even donate blood more, because if you download the app, there are aspects of it that will guide you where blood is required, where blood is needed, the blood type, and things like that. So it's really an innovation that we are happy to associate with.
After the incubation period under the Presidential Digital Talent Program, they were linked with the Ministry of Health. Other partners like AMREF also came on board. Matunda Nyanchama, an IT expert, has seen the application rise from its humble beginnings.
And Musasa was one of the top 5 that stood out, that looked at the issue of blood. And the way they were rated were, show me the impact. Does it have a direct impact on Mananchi? Does it solve a practical problem? Can it be adopted massively so that we are able to solve some major problem? And blood sourcing in this country is a big challenge. In fact, we hardly meet 50% of our needs, according to WHO benchmark. So if you can make it efficient in the way you source blood, we can reduce the gap between the demand and the supply. So this was one of the innovations that stood out.
According to Dr. Meshak Ndirangu, who is the country director of AMREF, a sustainable health system with functional blood services, requires key building blocks to survive.
I think what I need to talk about is the whole issue of essential medical commodities. You know, when you think of how we create better health or how we create lasting health change, you need to think about the 6 building blocks of the health system. You know, the health system has its own building blocks. And as an organization, we believe in what we call people-centered health systems. So we have the health system, and that health system is centered on around people. And the health system has 6 building blocks, from human resources for health, information systems, commodities and technologies, leadership and governance, healthcare financing, and then service delivery itself. And asking the question, how do all these work to ensure that no one is left behind?
Just how important is blood in our community?
I think when you look at the before and after of the blood ecosystem in Kenya, it's good to simplify it. And you can look at it from the side of the donor, the person who is donating blood, and you can also look at it from the side of the mother who needs blood, or the person who has gotten an accident involved who needs blood, the user, the patient. So, but then look at those 2 people they need to help each other. The donor needs to get blood to the recipient in time. So the whole issue of Damu Sasa is to make that happen. Because remember, you may be donating blood today here, and that is the blood that will be transfused to that mother who is bleeding in Madeira tomorrow afternoon or the day after tomorrow. How do we make that happen efficiently and make sure the blood is there when it is needed?
For a community hospital, the need for blood becomes 2 or 3-fold due to the scenarios that are likely to occur, especially during emergency. And the need for sufficient supply and transparency is key.
On average, you would probably need anywhere between 40 to 60 units within a month. And that is often informed again with the waves. Now, the interesting thing, what happens in medicine is a lot of the time, disease conditions, even where they are not communicable, come in waves. And therefore, you'll have a time when you have a wave of, unfortunately, ladies who are presenting with ectopic pregnancy. So that accounts for the variation that we might see. Now, in the event that we do not have blood available from our donor pool, then it places risk on the patient and the outcome. And not commonly, but there are times based on the unavailability of blood within not only our facility, but also those that we work very closely with within the ecosystem. Then we've had to refer, for example, patients to other facilities or see what other blood substitutes you could use, which are not as optimum as the blood itself, but in a situation where the blood is not available, then you have to make do to save the patient's life.
So how does this application work?
Damu Sasa is a platform that lists, tracks, and connects blood donors, blood units to transfusing facilities, logistics providers, and the regulator in a single technology platform for the sole purpose of saving lives for patients who need blood transfusion in a timely manner.
Damu Sasa began from our hearts, inspired by the Westgate Mall attack of the year 2013. We had lives that were lost due to insufficient blood in the country, and we needed to come up with a mechanism whereby we can address such challenges to ensure that there is sufficient supply. Upon engaging the professionals in the blood services ecosystem, professionals such as the hematologists, the nurses, the doctors, we realized that we have other factors that contribute to the shortage of blood cumulatively. Challenges on how management of the inventories are done, which potentially results to expiries and cold chain violation. There are challenges in coordinating multiple blood requests from different clinical areas. These result in delays in distributing this blood to the patients.
End-to-end encryption of blood services is not new in the world. In countries like Canada, the system works efficiently. Dr. Raquel Livagant from the Innovation Canadians for Change, or IC Change organization, has been working closely with the Kenyan team.
Yeah, so what's interesting is we have a similar model in Canada that's through the Canadian Blood Services. So they're a separate entity from our hospitals, but have the software and the management of all the blood units, and then the hospitals contract them, and then they get their blood donations that way and monitoring and things like that. So very similar to what Damu Sasa aims to do. But what's interesting is the digitization of our health, or of our blood system, came before some of the digitization of our hospitals. So I think it's a natural way forward because blood is such an essential component. It's so necessary for life, and it's something when you don't have enough of, there's really nothing else you can do. Some of the other things like tracking vitals you can do on paper. It's better if it's digitized. And I think that's the way the whole world is moving, is towards digital health and managing patients digitally. Just makes it easier for tracking and auditing. But I think Damu Sasa really is the first step to getting that digitization of healthcare throughout Kenya.
Kenya has been facing a challenge in blood supply and distribution since donors pulled out of the program. So how does innovation make life easy and efficient?
Just like we have M-Pesa or we have other technologies, I mean, getting technology to aid in blood donation makes it much easier. It gives you power to save a life. That's the way I would put it. When you have the app, you are able to know how many units of whichever blood group and in which site they are. And in case you are running short, it's very easy to know even where there is blood, and you can reach out and request for support with blood. So if I'm the manager of a health center, or rather hospital A, and I realize we are planning operations, or we have really run short, I'll issue appeals, blood donor appeals using Damu Sasa. But I'll also make sure that if something happens and we have really run short of blood, I know I'll talk to the manager of Hospital B or Hospital C, because I can see how much blood they have, and request, can you give me 5 units of this blood group, because this has just happened and we need the blood urgently. So you know, instead of just aimlessly saying, we need blood, it's directed, it's precise. And that's the whole idea.
The American Society of Hematology describes blood as a specialized body fluid. It has 4 main components: plasma, red blood cells, white blood cells, and platelets. It has different functions, including transporting oxygen and nutrients to the lungs and tissues and forming clots to prevent excess blood loss.
What we started with, remember, is saying that we consider blood a drug, because it's part of treatment. And it's a scarce resource because you are not able to manufacture it like you would paracetamol. So you have to get it from those who are giving willingly.
St. Francis Hospital is one of the facilities that have adopted the end-to-end use the blood system, Damu Sasa, to improve services while getting real-time data.
At St. Francis Community Hospital, we have already, as a facility, moved to being paperless. And so with the hospital management information system that we had, and with the coming on board of partners such as Damu Sasa, it was very key for us to also continue being paperless and being able now to plug into the additional transparency that a system that Damu Sasa presents.
In a busy setting at a hospital, just how efficient is Damu Sasa?
With the current system, is whereby we start by the registration of the donors. That is in terms of recruiting them. So in the recruiting them, we ensure that they have qualified in terms of age, in terms of their weight, and the blood level which is recommended. So that is the first part. That is the physical screening. And then we go to the next one. This is lab screening, whereby we test for the infectious diseases, which are mostly there around 5. So that one, after that one, we have done, and all the output is as per the criteria set. We now continue with the next step of now releasing the blood to the patients that need them.
Like any new idea, resistance must have been witnessed.
Initially, you see, it was something new. We have not had any other system like that one before. So definitely people have that fear of unknown. But to me and to my people who uses it, they have not had any challenge. It is easier because we're able to track the donors, the blood donated and the donors from the point of recruitment up to the end point, which is given to a certain patient. So there's an element of transparency. So we're able to know that each unit that was transfused has gone to the right or has been utilized in an open manner.
Various stakeholders have come out to support innovations like Damu Sasa, but there is a need for adaptability in the Kenyan market.
But what's interesting is the digitization of our health, or of our blood system, came before some of the digitization of our hospitals. So I think it's a natural way forward because blood is such an essential component. It's so necessary for life, and it's something when you don't have enough of, there's really nothing else you can do. Some of the other things like tracking vitals you can do on paper. It's better if it's digitized. And I think that's the way the whole world is moving, is towards digital health and managing patients digitally. Just makes it easier for tracking and auditing. But I think Damu Sasa really is the first step to getting that digitization of healthcare throughout Kenya. And so I see a similar, it won't be the exact same, but a similar type of collaboration between Damu Sasa and the hospitals and health facilities throughout Kenya in order to improve blood transfusion, which also helps with blood transplantation, platelet transplants, things like that. They're able to manage that and then make sure that you have a second party that's independent but able to track all the health and safety and inventory for that for hospitals.
I'm sure you've gone through one of the hospitals in the country, maybe?
Innovations are often accompanied by stealing of intellectual property rights, but Jerome Ochieng says innovators have to be equipped with the knowledge of protecting their idea.
So I think my word of encouragement is to request the transfusing facilities to have an opportunity to venture into this, even through a test program, so that they're able to see how it works and to facilitate them in terms of managing it. So it's something that really would be encouraged.
The Canadian Blood Services is a healthcare system that is part of Canada's broader network of systems. It is currently the only organization funded by Canada's provincial and territorial governments for manufacturing biological products.
But maybe one of the biggest things that's a little bit different is the blood donor culture in Kenya versus Canada. I've heard this more anecdotally, but there seems to be a bit of fear or like misconception surrounding blood donation, and that it's maybe dangerous or it's not safe or it's not the right thing to do. Whereas it's a little bit different in Canada, and by a little bit, I mean quite different, where it's something that people do frequently, and it's mainly just based out of altruism. So the idea that you give blood and then you never have to worry about if your family or your friend or someone needs blood and you're not around to give it. You never have to worry about being out of the country or trying to round up people to give them blood.
Here in Kenya, a bit of paradigm shift among Kenyans will be necessary.
The thing is, we still suffer huge gaps in blood. A woman who bleeds in Madeira or any part of the country still stands a significant chance of dying simply because they don't have blood. And this is because when you look at us as a country of 50 or so million people, we need roughly 500,000 pints of blood every year. But currently, only about 40% of that need is being met. You see that? 60% of the need is not being met. And because I say blood is an essential commodity, every need that is not met means a life in danger, or it means a person who needs an operation but cannot get it, or it means a child who has severe anemia because of an infection like malaria but cannot get blood and probably dies as a result of that.
Campaigns are normally conducted annually in the country to boost blood banks. Blood donors give it freely, but are there other underlying costs?
Whereas the donation of blood is free, there is a cost to blood, of being able to avail that blood for therapeutic purposes. There is the cost of the blood bag, there is the cost of screening, and again, depending on, the National Blood Transfusion Service actually stipulates what kind of tests are required. And the tests that are required, those are a bare minimum. As a facility, for example, we use really what the test standard is ELISA. So that also becomes a higher cost than just doing what we call the rapid test in terms of screening the blood. And for us, that's important because then you're able to assure your clients that the blood that we are giving you, we have this 99.9% certainty that it is free of disease. So there's that cost. So what we as the stakeholders in health and governments as well need to be able to communicate to citizens is that bit. Because for me, I get that a lot of the disgruntlement comes out because someone says, I gave my blood freely. Why is there a cost being attached to that?
At the end of the day, all stakeholders involved should ensure that there is accountability of blood donated by Kenyans to ensure that there is sustainability and availability of this important and rare commodity. Saad Hassan in Nairobi.
KTN News. Get the whole story.